Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services, and I am joined today by Dr. Roger Lever. Cases of COVID-19 have been increasing over the past 3 weeks. Last week, there were 54 new cases of COVID-19, and the percentage of positive tests to total tests was 12.1%. Unfortunately, this week we're on track to surpass last week's numbers. In just the first 3 days of this week, there are already 41 new cases. Dare County is now classified as a red county on the CDC's level of community transmission map. The red color indicates a high level of community transmission of the virus. Dare County and the state are in an acceleration phase of cases. Data indicates that a large percentage of new cases, in excess of 80%, are Delta variant cases. Compared to the original COVID-19 virus and other variants, the Delta variant is considerably more contagious and can cause more severe illness. It is critically important for everyone in our community to take steps to protect themselves and others from further spread of this virus. The number one way to protect yourself if you are age 12 and over is to get vaccinated. Additional measures include wearing a face covering, practicing social distancing when around unvaccinated individuals who do not live in your household, and using good hand hygiene. While the growth in cases is very concerning, the good news is that the vaccine is working. New cases among unvaccinated individuals are considerably higher than in those who are vaccinated. The goal of vaccination is to reduce transmission, but more importantly, to prevent serious illness, hospitalization, and death. Fortunately, the COVID-19 vaccines are doing just that. Yesterday, I received a very timely phone call from Dr. Lever. His call was unnerving, and his message was something that I thought needed to be shared with a broader audience, and Dr. Lever graciously agreed to join me today. Dr. Lever, thank you for being here, and thank you for the work that you're doing and for reaching out yesterday. I'd love for you just to share what prompted the phone call to me yesterday.
I'm Roger Lever. I'm a hospitalist, which means I take care of patients inside the hospital, acute and critically ill. I have done for about 20 years. I've lived on the Outer Banks and practiced in various settings and locations here. Currently, I work for Centera Medical Group as a hospitalist. You know, we've taken care of a lot of COVID, obviously. 6 months ago, it was the norm for me to have 3, 4, or 5 ill COVID patients just on my service. Certainly in the last 2 months, we have been happy to see the opposite happen, to where, frankly, we have not hospitalized a lot, and frankly, in the last 2 months, not unusual for me to go, a week without having to hospitalize someone. And we have seen COVID cases even in this period. Just, in this last 2 months, we have seen certainly a fair number of breakthrough cases. I think there's a lot of misconception about the vaccine, that if you have the vaccine, you can't get COVID. It's not the case. The way the vaccine works and is supposed to work, prepare your body to deal with this infection safely and efficiently, and so while we have seen a number of breakthrough cases, like I said, we have not had to hospitalize. I can't think if I've had to hospitalize one vaccinated person. Literally in the last week to two, I've started to have to admit almost on a daily basis COVID patients again. And so the numbers certainly ticking up. I think what certainly alarmed me, and I have not been, a strong COVID alarmist, but was the severity of some of the illness that we were seeing, particularly with regard to people's lungs and the extent of involvement of their lungs. And the other thing that was a little bit unusual about it, and again, this is very early and anecdotal data just from, my experience and talking to some of my partners, was sort of the demographic of the folks we are seeing. You know, when we were seeing, you know, sick people 3, 4, 5 months ago, most of them were people that had risk factors and fit a, you know, a demographic that we were somewhat expecting, you know, to see severe disease in. And as I say, over the last week, that has not been the case. A range of people from their 20s to their 60s, all fairly healthy, athletes, not the sort of people we would routinely expect to see severe disease in. All of them with extensive pulmonary involvement.
And the cases you're mentioning, were they vaccinated or unvaccinated?
All of them are unvaccinated. They're all fairly healthy. I think they'll all survive, you know, and hopefully we'll get through this. But yeah, it was hard to look at these pictures of these folks' lungs and not be, you know, impressed and alarmed by what we've seen. COVID is not Ebola. It's not just going to kill you, you know. But if you think it's the flu, you are sorely mistaken. You know, I've seen COVID do things to people that were the most impressive cases I've seen. I saw a gentleman going to something called rhabdo from COVID, where his muscles just started breaking down. This was from his immune system's reaction to COVID. You know, I saw strokes, heart attacks, you know, all intertwined with this thing. So a degree of physiology that you know, was humbling, frankly. You know, we don't know what's coming. I think we are very worried about what's coming in the fall, but I don't know that anybody would want to risk their health and their sort of, you know, long-term well-being for something that could have been prevented with a vaccine. I wouldn't want to find out and have my lungs look like that.
No, and I think that was a striking thing on the phone call yesterday. You shared that 3 cases in particular, you know, young adults into some maybe mid-50s who unvaccinated and hopefully, yeah, they will survive. I mean, that's what we're certainly hoping. And because of the extensive damage that you saw, they may never be the same.
Yeah, you cannot look at these films, and again, you don't have to be a doctor, you don't have to even be an expert. You couldn't look at these films and not go, you know, how is this person going to recover, and are they, you know, going to ever be, you know, the way they were before this. And again, I just would hate for people to find this out by finding out they have, you know, contracted, you know, something that again, you know, a vaccination would have, you know, prevented.
So please, if you are eligible to get vaccinated, do not delay. Dare County is hosting 2 vaccine clinics next week. You may register now online at darenc.com/COVID-vaccine, or you may call any area pharmacy. Please help protect yourself and others from the spread of COVID-19. If you have questions regarding COVID-19, you may also call the Dare County COVID-19 call center at 252-475-5008. Thank you so much for coming and sharing your message.
Oh, thank you. You're welcome.